very, very critical that we really continue to open up all venues so access to information is made explicitly available to all of our ethnic media. That has been something that I have been pushing for the last 6.5 years that I've been serving on the board here. And I'm excited that sometimes it takes a tragic moment in our history, whether it's the pandemic, COVID-19 that's upon us, that actually requires us all to come together. And this is very important for our families and our communities so that they get the information based upon the individuals that have the best mode of being able to articulate and get that out in a culturally and competent manner. And so I want to applaud everybody that has joined us today. And I especially am very, very encouraged to see that our county offices are taking part in this messaging, because they're the true validators. They're the ones that have the information that has to be given to our community. Now more than ever, it's very necessary. And I want to thank everyone for joining us, all the ethnic media groups that have been following us, but also have joined us today. Hopefully this is one of many events that will happen, and we'll continue to bridge that communication gap so that we can make sure that every ethnic group receives appropriate information. I know that this is very important because there are many people that we represent in the county that may not have their first language as English. So we do have to articulate, whether it's in Spanish or Armenian or Tagalog, whatever that is, we have to make every effort to see that people have the same access, that our standard is equitable across the board. And I think it's very impactful right now because of COVID-19. The fact that we're seeing the impact on the people of color, immigrant communities, essential workers represent I would say, a large number of people that have contracted COVID-19. And unfortunately, many of them right now are in need of help. Today, I want to introduce, and you'll be hearing from them, Dr. Tasha Dixon. She's the lead physician at Martin Luther King Jr.'s Outpatient Center, and Erica Flores Uribe, the emergency medicine physician and lead on the COVID-19 testing access equity effort, which again is very important. We're talking about equity, and both are with the Department of Health Services, and they'll discuss exactly how healthcare needs and services are being provided throughout the County of Los Angeles, and how we've been able to pop up testing and outpatient care throughout the county. You're also going to hear from one of my good friends, and that is our director for the Department of Public Social Services, known as DPSS, and that is Antonia Jimenez, who will also be speaking to you. Antonia will share really critical information to talk about protections for tenants during the crisis, including access to cash assistance, food assistance, and healthcare coverage through Medi-Cal. And she knows very well how impactful this is to get those services out to our community. But I want to also just mention that the reason why I'm taking this so personal is because in the first district that I represent, unfortunately, I have over 107,000 people out of almost 400,000 people that have contacted COVID. 107,000 and growing each day represent the first district. That is astronomical. And for me, it's unacceptable. And we have to find a way to bring down the curve of COVID by incentivizing our community to take advantage of all these healthcare services. And more importantly, understanding how to speak to our community. Because as you well know, the demographic that is most impacted right now are those that are 18 to 49 years of age. That's the demographic. And there are well over 232 cases of COVID right now. And out of the 414 and 185,000, those cases are positive. And that's why we're having to go through tremendous strain right now to restrict our involvement outside, and making sure that we adhere to the social distancing, using the mask, making sure that we get tested, and to seek any assistance that the county and other healthcare providers might provide for our community. Now, time is of the essence. And all I can say is that right now, between the African American, Latino, and Native American community and Pacific Islander community, we have the highest rates of COVID. including our healthcare providers, many who are women, who this is their sole source of income, having that job, but many get up every day to go out there to fight the good fight, and they're doing it for our community. So we also have to make sure that our community respects what is going on, and to also respect those healthcare providers. That's really what the essence is. We've done a lot already in the county, but we know we need to do more. And one way of doing it is by having a good voice that will come together to articulate our concerns to the state, as well as to the new federal administration that's coming in, because we do need a lot of support, monetary support, so that we can bridge the gap and make sure that we minimize those disparities. So I would just say that it's a wake-up call for us today. And I know there's going to be more news that is going to be made available here in the state of California. But sabes qué? We are one community. We are one family. So we have to work together. And we now, more than ever, have not to be afraid. I know people are anxious. I know people are hurting. But we're going to do everything in our power to see that we can try to mitigate any issues that they have.